Advisors to the Centers for Disease Control and Prevention have recommended a third dose of Pfizer's COVID-19 vaccine for people 65 and older, as well as others at a high risk of severe illness. The committee also recommended that people aged 50 to 64 years old with underlying medical conditions get a third shot, in a 13-2 vote. It also endorsed people aged 18 to 49 who have an underlying medical risk access to another dose, based on individual benefit and risk. The CDC itself has yet to offer guidance on the use of COVID-19 boosters for fully vaccinated Americans. The influential federal public health agency usually follows the advice of its advisory committees, although it's not required to do so. The recommendation expands the Food and Drug Administration's authorization on Wednesday to offer a booster shot for people aged 65 and older and those who run a high risk of severe disease. The FDA also gave the okay to give people a booster to ages 18 and up whose exposure to the coronavirus puts them at high risk of serious complications from COVID-19. The CDC recommendations, when issued, are crucial at this phase in the pandemic. As cases surge across the country, the booster guidelines will determine how widely doctors and other healthcare workers administer those vaccine doses. Dr. Sara Oliver, a CDC scientist, stressed at Thursday's advisory meeting that because the federal government has purchased all of the COVID-19 vaccines on an emergency basis for the pandemic, including the Pfizer vaccine, vaccine providers are required to follow the recommendations of the CDC and TH. The FDA authorization also allows the Pfizer booster dose to go to healthcare workers, teachers, grocery workers and those in homeless shelters or prisons, the agency's acting commissioner Dr. Janet Woodcock said in a statement. U.S. regulators will rule on booster guidance for those who have gotten the Moderna or Johnson & Johnson vaccine at a later date, reported the Associated Press.